Okay, I'm going to show you a few tricks and tips with the Barnhardt. The Barnhardt is a toed instrument, and you use it in the posterior teeth for interproximal calculus removal and the anterior teeth for removal of calculus in the fossas. What you want to do is you want to make sure that you have the right working end first. So what I do is I like to place the working end in between two teeth to check to see if the shank goes up and over. This is the correct working end. The incorrect working end will look like it's hugging the tooth. We don't want to hug calculus, we want to remove calculus. So what you want to do is, after you have identified the correct working end, you'll start in the get ready zone. I'm going to show you here on tooth number 13 and 12. If you could open just a little bit more for me, thank you. We're going to establish a firm fulcrum. Start in the get ready zone. I'm maintaining a 70 to 80 degree angle. Let me show you what a 90 degree angle would be against the tooth. This is 90 degree, so I'm going to bring it a little bit down for a 70 to 80. Now what I'm doing is I'm first using exploratory strokes, up and down, up, down, turn, to adapt to that tooth until I feel a piece of calculus. Then what I'm going to do is I'm going to apply lateral pressure, which means I'm going to bring the instrument with digital activation towards the tooth, so I'm underneath that calculus deposit, and then I'll do a short biting calculus removal stroke with wrist activation and adapt back, removing that entire piece. When I'm done with removal, I'm going to relax my grasp, pull my instrument out, go back over it with an exploratory stroke to ensure removal. Then I'm going to roll my instrument to maintain a 70 to 80 degree angle as I come across the facial of that tooth onto the mesial. Still exploratory stroke until I find a piece of calculus, lateral pressure, and short biting stroke. Another trick for establishing the correct working end is the elbow. Remember the elbow. The elbow will point posterior. If you take a look here, the elbow is pointing anterior on the incorrect working end. It doesn't matter where you put that instrument, the elbow is pointing out of the mouth. The correct working end, no matter where you put that instrument, the elbow is pointing posterior towards the back of the mouth. I'm going to show you instrumenting with the Barnhardt, a few teeth just for observation here. Open a little bigger for me here. Start at the get ready zone, 70 to 80, exploratory stroke until I feel a piece of calculus, wrist activation, calculus removal stroke. Make sure that you're going far enough interproximal to assess all the interproximal area of that tooth.